it help to loosen the scar tissue?
So one of the ways that it works is on the collagen and on the nerve fibers and the muscle fibers, so it should help, yes. You're talking about benefiting or whether benefiting, yes, it should help.
Hi, I've got two questions. The first one is, how does IM laser help someone with UTI, frequent UTI, not just like one-off kind of problem? Secondly is a person with glaucoma. Thank you.
Thank you. So UTI, you have to determine what the cause of the UTI is. If the UTI is recurrent, then the UTI may be caused by certain kinking of the anatomy, which the laser device is not able to change the anatomy, and that may cause the person to have repeated UTI infections. But if the cause is due to underlying factors like a stone, then the stone would have to be addressed. Or if the cause is caused by a lack of hydration, the hydration has to be addressed. So the underlying cause has to be determined. What is the cause of the recurrent UTI in the first case? And since it works on inflammation, if it is solely inflammatory related, like cystitis related, then it should be able to help. For glaucoma, pressure. So glaucoma is when there's an elevated intraocular pressure in the eye. So for glaucoma, it should be able to help. There are people who have used it for glaucoma and got good results with it. Reducing the intraocular pressure. Maybe to reverse the glaucoma completely, I have not come across any testimonials myself. To reverse glaucoma completely, you probably still need to use the glaucoma eye drops.
Okay, I have this question about erectile dysfunction. I know they will laugh. The normal treatment is use Viagra, right? The blue pill they call it. It is sildenafil. Now the function, the mechanism is that it blocks the enzyme that causes the reduction in the production of nitric oxide. Okay? Now since this one causes an increase in the production of nitric oxide, so when you use this, does it solve the erectile dysfunction problem? I become across such a...
So technically it should work, and I do have a patient who has erectile dysfunction who has used it and got results with it, but you have to use the nose piece as well. You need to use it regularly, and by increasing the nitric oxide production. But I wouldn't recommend targeted therapy in this condition, and don't share the device with other people if you do targeted therapy.
And it should work because they increase the production of nitric oxide.
It does work for erectile dysfunction, yes.
Thank you for being our medical magician today. Two short questions. Number one, can IM laser be applied directly to the breast lump? Number two, can an organ transplant patient like kidney transplant, can he or she use IM laser? Thank you.
Thank you. Good question. If the lump is caused by a malignancy, not recommended to use it directly at the site. It can have a stimulatory effect. Not that it's proven to aggravate the cancer, but just not recommended in general. Still can be used on the wrist and on the nose. Of course, if you're having ongoing chemo or radiotherapy, it would be advised not to use the device at that point of time until the treatment is completed. And for organ transplant, previously the question by the doctor was also on adverse effects. Not recommended for any patient who has immunosuppression. Immunosuppression means patients who are recipients of organ transplant. So any form of organ transplant is something to do with our immune system, and people are usually on medication to suppress the immune system. So it may not be recommended and to use for those patients.
Good afternoon, Dr. Ashvin.
Yeah, good afternoon.
I have two questions since you mentioned about immunosuppression. For people who have got autoimmune diseases, the common one is lupus, but there are also people have got cycloderma. Yeah, that one also they are taking immunosuppression too. Can they use this device? My first question. Second question is, does this device help people with depression? If it does, in what way? Thank you.
Thank you. Scleroderma, I would say, since it still falls under the category of immunosuppression, to consider avoid using it, because not enough clinical studies to prove that it's going to be beneficial for them, especially if they are on immunosuppressants. I wouldn't recommend to use the device for anybody who's on any form of immunosuppressants. And for the second question, depression patients. Yes. Depression patients, I do have one depression patient who has major depressive disorder, MDD, and used it and got pretty good results within about 3 months, but still on medication at the same time, but found improvements in the sleep, which also helps the depression and in the mood. So, yes.
Good afternoon, doctor.
Good afternoon.
I just like to have a doubt about myself. This, what you call this essential tremor?
Essential tumor.
Essential tremor. That's from gene from my father. So, do you think these things will help me? I try a lot of things. It doesn't help me at all. But I'm on medication. It slowed down my what? There is one time I can't even sign.
Right.
So when after the taking of medication, better. I love photography, but when I take the camera, the way they look, you can see. I like to serve people. Is there this thing? Do you think can help me? Thank you.
It should be able to help because essential tremor, the cause itself is medically sometimes difficult to diagnose. So because it works on the brain centers in the brain itself, and it works on the stem cells in the brain. So using the nose piece, you may get some benefit from it, but you may need to use it on a higher strength, maybe 4 bar and consistently at least about 3 times a day to derive any benefit.
Thank you.
Thank you.
Help me. I can sell it very well.
I have 2 questions. My brother-in-law, only 20% of his kidneys are functioning, so he goes for dialysis 3 times a week. Is it too late to help him with this device? Second question, the lady mentioned a glaucoma. How about cataract? Before it's really, moved to the level where you need surgery. Most of us have onset of cataract, even now without realizing it. Would that help also? Thank you.
So for cataract, it may not be if the cataract is already very progressive, then it may not be effective enough. You might have to turn to surgical methods to remedy the cataract because the progression is already quite late. But in early stage cataract, there is free radical damage that is going on. So in terms of the free radical damage, it should have some beneficial effect provided it started at an early stage. For the nose device, yes, you have to use the nose device. Yeah. Kidney, there are testimonials of patients who are already in kidney failure and they have used the laser device, and they have testimonies of people who actually have improvement in their symptoms in terms of their energy, and some even have reduced the number of times they have gone for the dialysis. So yes, but water restriction is an issue with these patients. So because they have water restriction, have to go a bit slow, see how they respond to it.
Hi, Dr. Douglas here. I'm doing live blood analysis with my clients, and each time before the test, I see a lot of bacteria roaming around. Then I let them wear the Vantros, and after 30 minutes, I'll take the blood, and I see very little movement. Does Vantros kills off these fellas in the blood?
The bacteria in the blood.
Yeah.
Yes,
It
Vantros.
has any effects on it because it's a very good selling point.
Are you sure you're seeing bacteria in the blood?
Those little things moving, you know.
Right. So there are toxins. So there are different kinds of toxins or byproduct materials that are there, and because of the detox component, it is helping to actually eliminate these detox components. So some people, even if you've done those blood analysis within one session, before and after, you can actually see the changes in the cell, and the person itself can already feel the difference. So you can see on a cellular level what the changes are experienced.
And I see sometimes, not sometimes, most of the times, those cells are like durian, you know, they have thorns. Now, after 30 minutes, I take the blood again to do the live blood analysis. Some of them, it reduced. Does it reshape the cells from thorny back to round?
So these cells actually have cellular damage, usually due to stress-related factors, stress onto the cell.
Oxidation.
Oxidation, yes. So due to that factor, the antioxidant effect, you can actually see a reduction in the number of cells, and you are seeing that with one session.
Yes.
Right.
So it does help.
Yes, it does.
Right. Now, nitric oxide is a godsend, beautiful thing in our technology. Does it actually clears the plaques in the heart arteries? What actually clears the plaque? Because nitric oxide, as we know, is a great dilator. It dilates the vessels. But what actually works? The benefit from Vantros that clears the plaques.
So when the blood vessels are clogged up, the blood vessels are clogged up for different reasons. Some of the reasons is because the blood vessel itself is constricted. So nitric oxide actually helps to dilate the blood vessel. There's an intima media. So that is where the nitric oxide is produced from, and that is what is going to help to vasodilate the blood vessel. And so when the blood vessel is bigger, the blood flow is better. And so when the blood flow is better, that itself has effect to clear off the plaques in the body. So the blood flow, just like a river which is stagnant, the clearance is much more reduced. So when the flow is better, then the blood supply to the heart is much better. But for example, if you're talking about patients who have heart conditions like myocardial infarction, there are clinical studies that have shown that it has reduced the infarcted area by about 50% over a span of something like about 6 weeks.
I have a patient with motor neuron disease. His muscles are dying. Can Vantros help?
So there are clinical studies on photobiomodulation therapy improving these patients with motor neuron disease quite significantly within a span of about 2 to 3 months. But they have to use the nose piece, have to use it regularly, and has to be used in tandem with their symptoms. So if the disease is already very progressed, it might just help to alleviate the symptoms, suppress the symptoms a little bit, just improve on those things. But if the disease is on an earlier stage, they might get a much better result.
Many people refuse, my clients, they refuse to put the nasal line. They say it makes them look like a clown or stupid. But I tell them it's very necessary, because if you don't put in the nose, you only get 50% or 60%. So what is actually the importance of using the nasal line?
So there are stem cells in our nose that are linked directly to our brain. There's a pathway between the nose to the brain. And based on a lot of clinical studies done in China and Japan, they have found out that using the nose piece actually stimulates certain pathways in the brain, where the brain is basically like the ECU of the car, right? It controls all the other mechanisms that occur. So all the centers in the brain are actually controlled, the other organs are controlled from the brain. So by working on the brain directly, it will help to improve the outcome of what the situation is accordingly.
Right. Last question. There are many extensive alcohol roadblocks in KL at night. For my customers who love to drink and they do not want to pay a heavy fine, can the Vantros help?
You might have to try tonight, but I recommend stay at home and have a few drinks and then see if it works after that. I have not had any personal testimony from this.
Hi, good afternoon. I have this problem where I need to drink a fair bit of water at night because I feel the thirst coming on. So before bedtime, I will take about half a cup. So, and then after about maybe, let's say if I sleep at 11, I will wake up at maybe 1 or 2 a.m. Then I'll go to the toilet. And after that, I need to drink about 250 ml of water before I can go back to sleep because I feel very thirsty. And then at the second time I wake up, it will about 5 a.m. Then go to the toilet again. And then I will have to drink another 250 ml of water. So the 8 hours itself, I will need at least 500 ml of water. Can this machine help me?
It may not be able to help in this aspect because this is more due to your mucous membranes or your salivary glands. As they get older, then you tend to be more dehydrated more easier. It could help on a collagen point, but I have not personally experienced anyone who has got benefit from this aspect. What you definitely need to do is you would have to hydrate more during the daytime, because most of us Malaysians are known to be more on the dehydrated level compared to other countries. We don't hydrate enough. So most people during the daytime they forget to drink enough water, and then in the evenings they start feeling parched and dehydrated, and then they decide they want to top up drinking the water, which ends up more water at night, and that affects their quality of sleep. So try to hydrate during the day. 2 to 3 liters would be good.
Okay, ladies and gentlemen, that's all for the Q&A session. For your information, Dr. Ashvin is a medical doctor from profession. He is our product advisor, but he is not our product ambassador. So he is not allowed to advertise anything about the products, okay? But he is trying his very best to answer each of our questions, isn't it? Based on his knowledge, his experience. So please give him a big hand. Thank you, Dr. Ashvin. So now we would like to invite Vantros General Manager, Mr. Andrew Ling, on stage to give a few words.
Okay, ladies and gentlemen, another big hand of applause for Dr. Ashvin. Isn't he wonderful? Yes, I learned so much from him today as well. But anyway, before I close off this sharing today, I would like to share with you something, okay, that is basically our promotions, okay. It is actually an incentive program. This particular incentive program actually, the duration is 2 months, started on the month of September until the end of October, 31st of October. Now, where are we going this time? We are going to, yes, South Korea, not North Korea. North Korea, I'm not going. But anyway, this particular campaign period, 2 months. Now there are 2 ways for you to qualify for this 4 days, 3 nights campaign. Now the first way is within this 2 months period, if you can personally introduce 9 persons who buy 1 unit of IM laser. Everyone buy 1 unit of IM laser, and you will get 1 ticket free. Okay, 1 ticket free to South Korea, 4 days, 3 nights. And the other way is by how? By achieving the rank of Emerald. Okay, within any of this month, and you will get 1 time Emerald, you will get 1 ticket. And if you achieve the rank of Diamond, you will get how many tickets? 2 tickets. So the highlight of this trip is not the South Korea trip. Remember, South Korea you can go by yourself. But this trip also inclusive visiting our stem cell factory. This particular factory is from Korea, and it produces a very high-tech stem cell extraction. They are working with us. This trip we are going to visit their high-tech plant as well. So don't forget, these 2 months, what you need to do? Introduce at least 9 persons who buy 1 unit of IM laser, you get 1 ticket. Or you achieve Emerald rank, you get 1 ticket. Or you achieve Diamond rank, you will get 2 tickets. So how many of you want to go? Only 1, 2, I forget about it. How many of you would like to go? How many? Now, for our company, we are setting our target at 150 packs. But 2 days ago, all the diamonds and all the gold diamonds already told us it will be more than 150. Okay, so I hope you take this opportunity to fight for this campaign, and I'll see all of you in Korea. Okay, thank you so much.
Thank you, ladies and gentlemen. So that's it for our health talk today. So thank you very much. Hope you have a fruitful trip today.